Well, it's very interesting because we have enabled our society with our medicines. We were, as I talk about the three eras of medicine, the first era being from Hippocrates through the 1950s, and it was public health issues, immunizations, and we took smallpox, which killed 200 million people, and we eradicated it with our vaccines without ever curing it. And so we were really enamored with that. The invention of penicillin helped people that died before of infections live, and we were able to perform all these cool surgeries and stuff because now people lived and they didn't get infected. But the reality is, in the second area of medicine, we tried to take that technology and apply it to chronic disease. And it hasn't worked well. In fact, it's been such a burden on society that we're at a point when we're about ready to bankrupt our medical delivery system. What we need to do is move medicine to the third era, where individuals, the people that are listening to this webinar today, we want to awaken you to understand that you need to be responsible for your health. It's interesting because there's a study that came out just last week on statins, on statin drugs, and showed that people that are on statin drugs are more likely to gain weight, more likely to eat unhealthy food than those that aren't on statins. So, we're lowering their cholesterol, but they're actually enhancing their dysfunction by eating the wrong things. So we need to help people awaken to understand that, number one, we're not like a car you can take into the repair shop. We need to fundamentally be in charge of our health. And that has to come from that awakening, David.
Well, that's the question that you ask in your best-selling book, Discover Your Optimal Health, is if someone offered you health, would you take it? And, there's a lot of Americans out there that maybe aren't convinced that better health means better life. They are, caught up in the nutrition pollution or the sedentary lifestyle, and they think that they're getting away with, lots of good things, and they don't see the consequences coming. And so the concept of, optimal health may be above or maybe so complex in their mindset that they don't even think that they can climb this mountain of optimal health. So what would you say to that person that's watching this webinar today, Dr. A, to the person that's maybe lost hope in the American dream?
Well, it's interesting. We have this nasty habit in our country of doing comparative reality. So, if you look at yourself and you're comparing yourself to one of those Olympic athletes that you saw in the last Olympics, probably that's not going to happen for you. So that's not what I mean by optimal health. What I mean by optimal health is to be the best you can be with what you got. So, that 20-year-old Olympian to be as healthy as they can be is very different than that of an 80-year-old that's had diabetes and 2 open heart operations. But what we're fundamentally saying is that if you make the decision that health is important, you can optimize yourself to be the best you can be with what you've got. And, in many cases, like, for instance, great example is type 2 diabetes. 95% of people have type 2 diabetes, and it is a lifestyle-induced disease. Certainly people that have genetic propensity, predisposition to it, have to be more careful. But the reality is it's something you can have total control over. So, once you're diagnosed, the system, so to speak, the medical system, the sick care system, gives you that diagnosis, and then you go to your doctor, you go on more medicines, they increase your medicines, they check your levels and your sugar, they give you more medicines to put you on that path, and over time it progresses, and the medicines help slow down that progression, but it continues the same. What we're saying is you can make the decision today to be optimal, and for most people that have type 2 diabetes, they can not only reverse their symptomatology, but actually reverse the disease process. And we're learning more and more that by creating the right lifestyle, by eating the right food, by reaching a healthy weight, by starting to have more activity, decreasing the stress, we can actually put you in a position where over time you can actually arrest that progression and actually reverse that disease. So that's what I mean by optimum. It doesn't matter where you are currently, you can make that decision, and then as you can see in this slide, we can move you forward to create a healthy weight, healthy eating, healthy motion, healthy sleep, healthy stress reduction, and then move you on to optimal health. And then once we have you optimal to be as good as you can be, then our focus continues on living a longer, healthier life. And the cool thing is, listen, I can't guarantee you're going to live longer. If you get hit by a car or something, have a bad accident, certainly you could die. But the point is, if you put yourself to be as optimal as you can be, you put yourself in a much better position, not just to live longer. Because, see, what's happened in America, our medicines have helped us live longer, but not in a healthy state. In fact, the studies have been coming out recently saying that we are prolonging the dying process, but the quality of life is not, for the last 4 or 5 years now, is going down. So we're keeping people alive longer, but in an unhealthy state, they're barely surviving. So as you can see in this slide, the forecasted path is we're born optimally healthy. We go through this period of non-sick, then we get diagnosis, and then we have disease. And that path is shifted to the left, where what we're finding is sooner and earlier, people are getting sicker. And we have young kids, unfortunately, that are now at a point where they're getting adult onset diabetes at as young as 5 years of age. So we've actually uncoupled the chronological and biological clock. In other words, our environment, our sick world we live in, our obesogenic world, is having us become more and more unhealthy at a younger and younger age. We have to stop the madness, reverse that trend, and actually focus on helping people create long-term success.
Well, and you've talked about the healthcare industry just not really having a solution, and the medications that have been promised for weight loss or health haven't come. What is your projection? Just being a top health professional, what would you say about the drugs that need to be provided, or do you think that they're even coming?
Well, they continue. I mean, listen, I'll never say never, but it's never happened to this point. Creating health is not something that comes from external to you. There's not going to be a pill. There's not going to be a process. There's not going to be something that can be done outside of you. It has to come from within. And so you can see, actually, and this is a great slide. This is from the book Discover Your Optimal Health. But that visceral adiposity, that little belly we have in the middle of us, is releasing all these things that are raising our cholesterol, raising our blood sugar, raising our blood statin, or basically our triglyceride levels, and all those things. We have a drug that treats the symptoms. But the interesting thing about that, simply by losing that belly, you can reverse your need for any of those drugs. So unfortunately, yes, we're keeping people alive longer, but they're miserable. They're overweight. They're not feeling well. They're barely thriving. And clearly, this slide shows it's not a model for health. And so fundamentally, Take Shape for Life and our construct is, listen, let's awaken you to transform your health. Let's put you on a new path. Let's give you a guide to help coach you. And let's surround you with other like-minded people. What we know is this. We know that obesity is contagious. The Framingham study, 2006 study was released in the New England Journal of Medicine, showing that people that hang out with people that are overweight or obese have a tendency to get overweight and obese. So what we're doing is reverse engineering. We're creating this new optimal health where we can help you transform your health, David.